Hello everyone, and thank you for your warm welcome yesterday. So today is the first recording I'm going to be doing on injury prevention, and today we're going to be talking about the foot and ankle joint. Okay, before we start, I think it's important to know a little bit about the anatomy. So firstly, the ankle joint is made up of three bones, and the first one is the tibia, so that long shin bone. The second one is the fibula, the one right next to it. And thirdly, probably less commonly known to you, is the talus. Okay, so as you can see, this forms what's called a mortoise joint. Four main movements here at this joint. The first one being plantar flexion, so that's pointing your toes downwards. Secondly, there is dorsiflexion, which is bringing your toes up towards you, so making that angle between the shin and your toes even smaller. And then you have inversion, which is putting your foot inwards, and eversion, pushing your foot outwards. Most common related injuries at the joint, and what we're going to focus on preventing, is lateral ankle sprains. So the word lateral itself indicates that it's on the outside of the joint. So I don't know if you can see the little bony bit, and you see like that red little marker which has been used as a pivot for the plantar flexion and dorsiflexion. So located there is ligaments, muscles, tendons, and they often get injured when we perform these movements, but excessively. So the most common for the lateral ankle sprain is a combination of excessive plantar flexion, so pushing your foot too far down into the ground, or if you think about it when you're running and you miss a step, then you're coming down a curb, then that foot is in that pointed down position, in combination with inversion. And you can see there on the inversion picture, that is pretty much how we do our ankles. So it's in plantar flexion, inversion, and then you get a stretch to those structures I've discussed on the outside of the ankle. Let me just show you those structures in a little bit more detail. Firstly, let's have a look at the connective tissue. Now, this is not an anatomy lesson, so I'm not going to go into too much detail. We're just going to call all these around here the lateral ligaments, okay? And that's where we can do special tests in clinic just to make sure we understand which ligament is injured and tailor rehabilitation appropriately. And then you have the muscles as well, which come on top of that. So there we have a tendon, and these muscles here are very important. So the fibularis brevis, and also here we have the longus, okay? That's really important as well, just mainly due to the location of where those tendons are sitting in. You can see it's on the outside of the ankle. So keeping them strong as much as possible is important to reduce any likelihood of an ankle sprain. So runners as well, they tend to neglect this muscle here, the soleus, which sits deeper than the gastroc muscles. You see I've just put that layer on, and you take that away, you have that muscle there. So I'm going to show you a couple of exercises to firstly keep that nice and loose, flexible, and also keeping it strong, because it takes a lot of the weight when we're landing, when we're running. So that was a quick overview of the anatomy of the joint, which I think it's good to get a basic understanding of, so you know why you're doing prevention training, to make it strong and robust, and just to understand a little bit about the complexity around that joint. But don't worry too much. The point of this is to show you some exercises to keep it strong, flexible, and nice and stable to prevent injury. Okay, so I'm going to pop on downstairs now and show you some exercises. The prescription for each exercise is just a guide, as it will vary per person. This one here, you want to make sure your heel is down on the floor. You get to that comfortable range where your knee's still able to touch the wall, but your heel does not come off the ground. This one here, you want to lower yourself down on one leg, and then also bring yourself up on the other leg. So you're making sure the muscle is lengthening and strengthening at the same time. This one here is with your knees bent, as it targets that deeper gastroc muscle called your soleus. This one here, repeat for the prescription provided, but you can also add some weight. This one here, you can just use a timer and challenge yourself. Closing your eyes will challenge your proprioception. This one here is a nice one to do just before you go running, as it really gets everything firing around your ankle. Okay, so that was a few exercises which focused on the mobility of the ankle, the strength of the ankle, and also the balance and the proprioceptive work we want to look at. The proprioceptive thing is an element where you can challenge it a little bit more. So when you're balancing on like a cushion, or maybe just starting on a stable surface and then closing your eyes, so that reduces the sensory input and makes you kind of have to challenge different messages from the brain to the ankle to make it nice and stable, but also reactive. So if you get in a situation where you're kind of coming down a step, you want your body to be able to adjust quickly and maintain that stability instinctively. Please just be aware that some of these exercises may be a little bit too challenging for you at this stage, especially the hop and stick exercise. Therefore, contact me or contact the guys at the Fit House, and we can explain a little bit more on how to get a little bit stronger so you can build up to that strength base. Absolute privilege to do this today. Tomorrow, I'll be talking about the knee joint and injuries associated around that. See you all soon. Bye-bye.